It's 7:49. Accidents are the leading killer of people under 39. It's the third highest cause of death among Americans of all ages. And no hospital has been as successful in treating the critically injured as the Maryland Institute for Emergency Medical Services in Baltimore. Shock trauma, as the center is known as, is actually part of a whole emergency rescue system. And the center's results are amazing. The people there have lowered the mortality rate for these patients with serious multiple injuries from over 70%, and that's the nationwide average, to around 18%. More than 80% of their patients do recover. And Dr. Adams Cowley is the founder of the center, which is the subject of a new book called Shock Trauma, and he's here with me this morning. Good morning, Doctor.
It's a pleasure to be here.
I think we should start just by talking about what is shock trauma.
Well, it's a combination of two words, shock and trauma. Trauma is a medical term for injury. And with injury, if you're hurt bad enough, why you go into shock.
It's the body's reaction.
Yes, it's a bodily reaction. We're all feedback mechanisms, just like everything else. And if you aren't treated very rapidly, you don't survive.
So we're talking about serious accidents here.
Yeah.
Now, I understand that there's kind of a golden hour, that very beginning time that's so important.
Well, we call this the golden hour because in our animal research and in looking at the patients we've had over the last 15 years, there's a time frame where if you're severely injured, and what we call these people multiple crunches, if they're not seen by the right persons at the right time, in the right facilities, you're not going to survive, and it has to be done in an hour.
So we're talking about getting to the scene, helicopters to get the people back to the hospital, a whole rescue effort.
Well, in our state we have a total system, communications, ambulances, helicopters, and so forth. Most of the people who are injured are out in the country, and that's 70% of the mortality, and that's why we developed a very strong helicopter program with the state police.
Yeah, now we do have some film of shock trauma at work. This is from a documentary. It's produced by Paul and Holly Fine from our Washington, D.C. affiliate WJLA-TV. And let's take a look at that right now. We'll see how it works.
There will be an admission in 5 minutes. There will be an admission in 5 minutes.
All right, now maybe you can explain to us what's happening here.
Well, there is a helicopter. It's landed near the scene of the accident. It's night. It's a Huey, and the patient's being brought by our expert people on the outside, and they're so important.
Looks like a large
EMTs
team.
And the paramedics, yeah. And now you see the helicopter landing at the helipod, and the ambulance ready to pick them up. Sometimes we have 3 helicopters landing at the same time. And that patient is immediately transferred to the ambulance. The patient's examined immediately in the ambulance to see if an airway needs to be established or what other. And within 5 minutes, the patient's over in the trauma unit. Now, this patient was quite ill, as you will see. The pictures we take, as you see someone giving him artificial respiration and CPR. And now in the OR, and all of this can be done within minutes because you don't have long to live with severe multiple injuries. And severe multiple injuries are head, chest, belly. We call those the systems. And now they go into this critical care unit. And a critical care unit is more sophisticated by far than an intensive care unit that
in a regular hospital, yeah.
Yeah. And you can see keeping the lungs clear is very important, and that's what this physiotherapist is doing. And also, even our patients in coma, we talk to them, our nurses talk to them. We feel it's very helpful, and I think it really is.
It's all that extra care. You say something that's quite impressive. You don't believe in the dead on arrival concept, do you?
We will get in the summer about 3 patients a week who are thought dead and so forth, no pulse, no respirations, and 2/3 of them are back to work.
It looked to me like in the film that there were a lot of things going on at once, like even more than one operation at a time. I think this is part of the program, trying to attend to everything. That's not what they do in a normal hospital, is it?
No, ma'am. These are total system ways of care. We have teams. In the operating room, we only give one anesthetic, but there will be maybe 3 teams of surgeons working on different parts of the body at once. And it's these kinds of things that we do so that when that patient gets back up to that critical care unit, he's got nothing to do but start getting well.
What is the major cause of all these accidents?
Automobiles.
Automobiles? Is drinking a major?
Well, drinking's a major contributor to the automobile accident.
It seems like everywhere in the country we should have a center like this. It's almost a little frustrating that it's only in a couple places. What can people do?
I think it's starting, and people are beginning to become interested in this, but for 10 years it's been a terrible struggle. And what you can do is contact your agencies, the HSAs. You can contact the American Trauma Society.
Maybe your congressman?
You can and get your legislative people, your congressmen and senators involved. They can help a lot.
Thank you so much. It's such a tremendous center. Thank you for being here this morning. We're going to be right back.